Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna reveal the 5-minute routine that you can do at home that can stop your joint and muscle pain. But before I do that, I'm gonna reveal what over 45 study revealed as a secret for long-lasting pain relief that your doctor not there to tell you about. I will also cover what you don't know that could cost you thousands of dollars and lead to disability. We're going to go over the normal healing cycle, treating the root cause of the problem, and the steps that you can take at home today to relieve your pain. So, very important to know what is the definition of disease. Because when we understand that we're not gonna stuck in diagnosis that sciatica, carpal tunnel, or plantar fasciitis, because disease actually based on the definition of diseases, it's a specific signs and symptoms, and it's actually give us a specific location for the problem, but does not tell us how to treat it and how to treat it effectively and how to get to the root cause of the problem. And that's what will lead us to understand the normal healing cycle, so you don't have to stuck in shoulder pain, back pain, neck pain, but we need to know to understand how the body works in order to treat it effectively. So the secret 5 minutes treatment per day gonna cover or can be used to treat jaw pain, neck pain, headache, sciatica, plantar fasciitis. When I go over the healing cycle, it will make sense that we will be able to treat all of that, because the definition of diseases is actually the location of the disease with signs and symptoms. But when we understand the normal healing cycle, it will make a lot of sense that title of the disease is not what we're gonna treat. It's the internal inflammation or internal damage in the body. So I'm not gonna go over the 45 studies, but I'm picking one study that actually reviewed 16,000 articles, research articles, and that study actually summarized the finding of those articles on which treatment is the most effective and which treatment are not effective that you don't need to use, so you're not really wasting money and time. So, based on the studies, they actually looked at 16,000 articles at least, and based on that, they included 57 studies, 50 of them systematic reviews. Why this is important? Systematic reviews is a study that the researcher decide, I will look at the efficacy of massage, for example, for neck pain. So they look at all the study that done on massage, and that used for neck pain, and they decide which studies are quality studies and summarize the finding of like hundreds or thousands of studies, and coming up with the conclusion, is massage effective or not effective? So these studies very valuable because they actually do the legwork for us to actually looking at the majority of the study that done on the specific topic. So this study, they actually included 50 systematic reviews, and they were looking at the efficacy of the treatment option for pain. So this is a literature review. They also include 2 other literature reviews for randomized control trial and 1 non-randomized control trial. So, summarizing the study, this is a mind-blowing actually. As a physical therapist, when I went over this finding, I was actually very disappointed, because a lot of modalities we use in physical therapy and with a lot of healthcare providers, the studies shows they are not effective. So, based on 8, like looking in the schedule and the table here, 8 systematic reviews saying that stretching and exercises does not provide long-term pain reduction. They actually provide short-term pain reduction. Spinal manipulation or mobilization or adjustment, 6 systematic reviews says it does not provide long-term. pain reduction. Acupuncture, trigger point injection, myofascial release, dry needling, massage, and so on and so forth in this table. As you see, there is those systematic reviews looks at hundreds and thousands of studies, and it's hard to argue that the treatment is effective if hundreds or thousands of studies saying it doesn't work for relieving pain. So the conclusion of the study is treatment methods followed the biopsychosocial model seem to yield long-term pain reduction. This is very important, and I will explain what is the biopsychosocial model. Increase range of motion, improve the function, activities, and on the other hand, the single modality treatment methods seem to yield either short-term pain reduction or no pain reduction. And going back here, these are the single model treatment that showed, based on a significant amount of studies, that it either provides short-term pain reduction or no pain reduction. To summarize it, the non-effective treatment is like ice and stem, foam roller, dry needle, massage, joint mobilization exercises, and stretching. So the main important point that we need to understand why the biopsychosocial model provide long-term pain reduction. And based on this study, there's at least 7 to 9 systematic reviews that prove that the biopsychosocial model provide a long-term pain reduction. And that's our main point here. What is a biopsychosocial model? How to do it at home so you can have a long-lasting pain relief, because the studies actually prove that. So, what is the biopsychosocial model? So, the biopsychosocial model is divided to 3 big categories. Is the biological part of the body, like your physical body part. The psych part is your behavior, your support group, your learning, your memory. The social part is the education, and so on in this list. To simplify it, how to implement that and what part of the model that we need to do at home to really get a good result. So when you think about it, to have the biopsychosocial model, you need to have treatment for inflammation, for nutrition, for soft tissue release, ergonomics, massage, meditation, behavior modification exercises. So based on the studies, they found that when someone go to at least 5 different healthcare providers for the same condition, for shoulder pain, you see in chiropractor, you see in PT, you see in behavior modification therapist, you see in nutritionist, you see you go into meditation class or psychotherapist. That's when you have a long-term pain reduction. And that's a big problem, because when I start to ask patient, and we looked at why patient is not compliant with the biopsychosocial model, because it's very effective. Everybody's saying, I don't have 5 hours a week to spend on going to 5 different healthcare providers, paying 5 different copay, or if you don't have insurance, you have to have the cash to pay for 5 different healthcare provider services. So we find that actually with the complexity of the biopsychosocial model that's very effective, it's actually hard to be compliant with, because patient does not have the time, the money, the energy to invest in different healthcare provider to get the treatment. To simplify it, why we need the biopsychosocial model? Think about this way. Your car needs a tune-up. You cannot pick and choose which body part you're going to do for the tune-up. That's not a full tune-up. So the biopsychosocial model, it's like a full body tune-up. So you have a shoulder pain, but that shoulder pain is affected by your ergonomic, your posture, affected by your stress level, affected by your diet choices, if it's a good diet or poor diet choices that cause internal inflammation. It's all connected. So when you go to have a car tune-up, to really improve the performance of your car, you need to really clear up the whole system. And that's exactly what we're gonna do, what we will learn in this video, how to do a full tune-up to really get to the root cause of the problem, because the studies prove that when we do the biopsychosocial model, that's when you get a long-lasting pain relief. And to answer the question, how you waste thousands of dollars and leading to disability, by using modality that actually, based on the studies, does not provide long-term pain reduction. And actually, if you don't address your pain on the right time, it's probably going to be too late to address it at all. So it's better to start with the treatment that works before it's too late and using modality that's wasting time and money, and actually get your symptoms to a chronic condition that's hard to treat. So what is the solution? What you can do at home? So the solution was very simple, by inventing ASTR approach, which is actually is considered a biopsychosocial treatment model that addressing majority of the aspects of the model and actually can be done at home. So through ASTR treatment, simplifying the model with the simple exercises, simple ergonomic training, simple posture training, simple medical tools that can be used to actually get to the root cause of the problem in the comfort of your home. What is ASTR? ASTR is a biopsychosocial model that treats the body utilizing ASTR instruments, maneuver, theory, methodology. The treatment actually includes the scar tissue, fascia restriction, trigger point, muscle spasm, inflammation, stress management, and behavior modification. Basically, the treatment covers majority of the aspects of the biopsychosocial model that has to be addressed simultaneously for long-lasting pain relief. Think about this way. You need to have a tune-up. You cannot say, okay, I'm going to have massage only and that will solve the problem. No, because the study shows it doesn't work. Oh, I'm going to do stretching only and it will work. No, stretching will not going to work, because actually 6 to 8 systematic review says it doesn't work. So through the treatment, we will address inflammation, scar tissue, fascia restriction, and so on in this list. But before I go over how to do that at home, we need to understand the normal healing cycle, so it will make sense why we need to work on all of these simultaneously. Okay, so I'm gonna use external paper cut for visualization, but the same process happened internally. From accident, from trauma, poor posture, poor body mechanic, does not matter what kind of diagnosis you have here. If they label you with sciatica, plantar fasciitis, shoulder pain, back pain, your body has to go to the same exact program to heal. So, because we don't see it, I want you to visualize the external paper cut example. So the first stage of healing is inflammation. During this stage, you start to have swelling, redness, the blood starts to rush to that area, and you can see it in the first image. The second stage of healing, it's called proliferation stage, and you can see here in this image, you start to have a scar tissue, fascial restrictions, muscle spasm, trigger points. Perfect scenario, during the maturation stage, your body should get rid of the scar tissue, clear up the inflammation, and everything clears up. That could take days, weeks, months, or years. As we get a chronic condition, the body usually going back and forth between inflammation stage and proliferation stage. So I will give you example of scar tissue to visualize why this could be an issue as a proliferation stage. Our muscle should act like a rubber band when it contract and relax and stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it will not stretch much. So from the proliferation stage, you start to decrease range of motion. That scar tissue could compress on nerve and artery, and you will be labeled as carpal tunnel patient or sciatica patient or plantar fasciitis, because the fascia is tight and your scar tissue is pushing on the tissue underneath it. What's look like internally when you have a strain or you have a scar tissue, your muscle should look like nice and smooth like this image here. When you have a strain from like poor posture, poor body mechanic, or accidents or any injury, you start to have a micro tear like this. Your body has to build the scar tissue, and usually that happens randomly like this, that could cause restriction and compress on nerve and artery and cause nerve pain. So when the body builds a scar tissue, it usually happens very randomly. And I want you to try this at home now to see if you have a scar tissue. If you slouch a lot in the front of the computer or your phone, you're probably going to have a knot in your trap muscle. So I want you to push down there. If you start to feel like a knot, like hard tissue, there is very high chance that is a scar tissue that you have it there. So that's a scar tissue that's going to limit the range of motion, cause pain, and could cause headache for some patient, and other symptoms. So to really get to the root cause of the problem, we really need to break that vicious cycle of inflammation and proliferation simultaneously. That's why when you go to physical therapy and just doing exercise and stretching, you're not going to break the scar tissue. You're not going to release the fascial restrictions. You're not going to address the inflammation. You have to have a second treatment for inflammation. And if all of these cause because of your slouching forward and you have bad habit, you need to go to ergonomic training class to teach you how to do the right thing, because if you do the release or do the exercises without correcting your body mechanic, that will not be a long-lasting pain relief. So how to address it? We really need to address the whole vicious cycle of inflammation and proliferation. As you see here with the model that I'm gonna present it, we have to work on the scar tissue, fascia restriction, trigger point, all of these actually in the healing cycle that affected by a healing cycle. At the same time, we need to correct your ergonomic, because just slouching like this in the front of the computer, your head weigh around 15 to 20 pounds. So when you slouch forward like this, your head weigh around 60 pounds. So that bad posture will cause more strain in your neck, will cause tear or a strain that could cause inflammation and vicious cycle of the proliferation stage 2. So we have to get to releasing all the tightness and then correcting the biomechanics that actually causing the issue. So how to address and break down the vicious cycle? That is actually we have to work on inflammation. Initially, I like to work on inflammation. So what I personally do for inflammation, and it depends on how severe is the inflammation. If it's mild inflammation, I use a MagnaHeal 2. This is very strong magnet that's actually, the range of the magnetic field is around 3 inches, that actually go inside the body to decrease internal inflammation. And part of the biopsychosocial model, we need to decrease the localized inflammation, plus we have to do the anti-inflammatory diet. So I included that with the treatment protocol to make sure you're not eating food that actually cause more inflammation. Because based on our studies, inflammatory food, for example, like refined carb, refined sugar, cause internal inflammation in the body 4 or 5 hours after eating. So if you eat inflammatory food 3 times a day, your body in internal inflammation for 15 hours a day, and that will slow down your healing. So the other thing I use for inflammation, the pain relief cream that actually has anti-inflammatory ingredient to help with decreasing the inflammation. For severe cases, we have to internally include some supplements that actually cause the body to calm down the inflammation. And those supplements, including joint muscle repair, collagen active, magnesium, and so on in this list. So we have to work on the inflammation. At the same time, we have to work on the proliferation stage. As you see in this image, we have to break the scar tissue. We have to release the fascia restriction, muscle spasm, and trigger points. So to break the scar tissue, I use the A3. This is a very easy to use tools. Even my 5 years old, actually, they know how to use all these tools on themselves. It's very simple to use. Use the A3 to break or release the superficial scar tissue. And for deep scar tissue, that's why massage is not very effective, because it cannot go deep enough to break deep adhesion, and it's hard with the hand to do that. So I use the A5 that can go deep in the body, 2 inches to 2.5 inches, to really break deep scar tissue. And actually, I use it for fascia restrictions and for trigger point at the same time. The other part of the proliferation stage that actually overlooked by a lot of healthcare providers, and I will go over it briefly here, is the fascia system, because it has very significant effect on the body or the pain that you might experience. For most of musculoskeletal issues, they usually have a fascia restriction involved. And when I go over the system, it will make a lot of sense why this could be involved. So the fascia system, the superficial layer, it's like a wrap surrounding the entire body. It's like a Spider-Man suit wrapping the entire body. Very thin layer, you can see it here, the white filament on those images, that is the fascia layer. And next time when you go buy meat, look at the white filament, that is the fascia layer. So when you have fascia restrictions, it's like you're wearing a t-shirt 2 to 3 size too small. So it's gonna compress on everything underneath it, and you will not be able to move around because of the limited range of motion. To make things more complicated, but don't worry, the treatment very simple. The fascia system is divided to 2 main categories: superficial fascia layer and deep fascia layer. And the deep fascia layer divided to 4 subcategories, and each of those categories have 2 to 3 layers on the top of each other that should be gliding smoothly. So we have the apparatic fascia wrapping a group of muscles. Then we have the epimysin that's wrapping each individual muscle. And then we have the premiysin that's wrapping a bundle of muscle fiber. And then each individual muscle fiber wrapped with the endomysin. And that shows you how complicated the fascia system. And when you start to have a scar tissue or a strain in the muscle, that scar tissue adhesion actually cause the tissue to glue together and lose elasticity. So your fascia gonna get very restricted. That scar tissue gonna limit the muscle to contract, decrease the range of motion, and a lot of time when it's closer to a nerve, it causes compress on the nerve, causing sciatica, carpal tunnel, and other nerve issue like Morton's neuroma or other issues that labeled by the location, not labeled by the root cause of the problem. So when we understand the anatomy, the normal healing cycle, and we have the right tool to break that vicious cycle of inflammation and proliferation stage and correct the body mechanics, eating healthy food, that's how we can get to the root cause of the problem, because the study shows the biopsychosocial model is the most effective approach for long-lasting pain relief. So how to do that at home? It's very simple. What I personally do is I use the A1. This is used to release the superficial fascia release and the apparatic fascia release. And I use the A5 to release the epimysin, premiysin, and endomysin. And most of the patients, they can do that at home. If it's in the front of the body, the treatment usually takes 5 minutes using those tools to release it, doing simple exercises and correcting the posture, and usually can experience significant pain relief because we're implementing the biopsychosocial model. So, how to treat yourself at home and why it takes 5 minutes? Because the tools is actually very simple to use. The tools takes a few seconds to a minute to use it, and you can use it every day to relieve your pain. So, what I've done to simplify it for patient, I recorded the biopsychosocial model for each body part. So, if you have a neck pain, I have a program for neck pain, back pain, jaw pain, headache, migraines, plantar fasciitis. There's a program for each body part. That program shows you how to use each tool for that body part, plus the rest of the biopsychosocial model, how to correct your posture, ergonomics, body mechanic, the behavior modification that you need to do related to your injury. There is a different behavior modification that you need to do for neck issue than the back issue, than the foot issue. And that's based on intensive research. I went over thousands of studies to go over these programs to find the most effective approach and what should not be done for a lot of these conditions to get the best result. And I summarize it. And each program about hour and a half video. You just watch the video, follow the simple steps to use the tools at home. So I divide it to 3 packages. If you have a mild pain, which means your pain level from 0 to 3, so we have a package for using the tools plus the Magna Heal 1. This is less, this Magna Heal 1, the range is 2 inches. That's for mild inflammation. If you have severe, moderate inflammation, so your pain level from 4 or 6 out of 10, that's mean you have more inflammation. You need a stronger Magna Heal to really go deeper and decrease the inflammation, and that's what I include the Magna Heal 2, and that's wearable magnet that can be worn from head to toe. It has 3 belts that can be adjusted. If you really have a very severe inflammation and your pain level from 7 to 10 out of 10, the recommendation, you get the severe pain package because you have a lot of internal inflammation. We have to calm it down with supplementation plus doing the localized release. These formulas are very effective to decrease inflammation. I have a lot of patients with arthritis, severe inflammation. When they start on the supplement with using the tool and the program, they see significant improvement when they implement the protocol. One of the formula that they have is joint and muscle repair. This is very comprehensive formula that has like 4 different supplements in one to decrease inflammation naturally, to help repair tissue damage from arthritis, rheumatoid arthritis, or osteoarthritis. Very effective formulas that help with the internal inflammation. So it's very simple. Based on your pain level, choose the package, and the following the screen, you choose the body part that you want to treat. You get access to step by step how to use the tools, how to implement the program for your body part, and you can do it at home. You probably can treat your whole body by yourself except some body part like reaching back to your back. I'm able to reach to my back and actually treat my back with the tools long enough to do that. Working on my foot, my knee, my ankle, it's very simple to do that on myself, my shoulder, my neck, my head. I can do that. Some body part you might need help from a spouse or a family member to reach back, but the treatment takes about 5 minutes to really use the tools on self. I'm offering this for a very limited time, a free consultation with one of my health coach. We have a very limited spots. If you're not sure which package is the best for you, or you have other questions that you need a more customized treatment for your condition, feel free to click the link below to schedule an appointment with one of my health coach. I'm offering this for a very limited time, and we have a very limited spots. The consultation consultation about 30 minutes, and it's free for a limited time. It costs around $2.99, and that consultation will be a very customizable treatment for you based on your answer to a specific questionnaires that the health coach has to figure out which option is the best for you. It's very simple. Based on your pain level, choose the package, and the following the screen, you choose the body part that you want to treat. You get access to step by step how to use the tools, how to implement the program for your body part, and you can do it at home.